I am live, so people can start joining. Get ready for the lecture tonight. Welcome, welcome. Just drop a comment. You're here, drop a comment. I can see people are coming. We're waiting for others to join us by 7 p.m. The brain. You're welcome, welcome. We're waiting for others to join us. By 7 p.m., we start the lecture immediately. We have more 5 minutes. I came early because I don't go for my lectures late. I go for my lectures early to wait for others to join. So I have some anatomical structures. Anatomy is a very interesting course. We try as much as possible to demystify the studying of anatomy tonight. I do tell my students one thing about anatomy is that anatomy is the only course that when you are in the exam hall, they ask you to draw or write on the body part. It's already there with you. So imagine they say write about the eye. You can just look at maybe your colleagues and draw the external features of the eye. At least you have written something. So it's what you can see and feel. It's structure, anatomy structure. You're welcome. As you come, you can draw comment, subscribe, copy the link, and send to others uh, for them to join us because we have 3 minutes more to start the lecture. Ryan, you are welcome. Wilson, you are welcome. Good to see you. Please copy the link, share to people to let them know that we are live. We are here so that they can join us. Mirabel, you're welcome. Thank you for coming. Mirabel. Wilson, thank you for coming. Rayan, thank you for coming. Please drop your comments, subscribe to the channel, share the link for others to join us. I think it's 7, so it's time for us to start. Why we expect others to join us for the lecture tonight. Oh, Nigeria has happened. Just taking the light. We hope that the light will be restored. Just a few minutes, let the light be restored and we can continue. Sorry for that. Trying to restore the light. You are welcome. Once the light is restored, we'll start. Josiah, you're welcome. Sorry for this. Temple, you're welcome. Thank you for coming. Thank you for joining us. Oh, sorry for the inconveniences. It starts the lecture immediately. Good evening, everyone. Good evening, good evening. My name is Dr. Lekpa David, lecturer in the Department of Anatomy, University of Port Harcourt. I'm glad to have you here. I'm glad to have you here. Oh, the light has gone again. It is a privilege to have you tonight for this live section. And while we are trying to restore the light, I will commence the lecture immediately. Permit me to share my screen. So I'm here to give the lecture on how to write and pass anatomy with ease. Anatomy is one of the courses taken in the medical school. Students of anatomy, physiology, medicine, biomedical technology, medical imaging, different professions in the medical field. Anatomy is a compulsory course that you take to ensure that you move forward. So it is important for us to understand the anatomy of the human body. So from statistics, anatomy is one of the leading causes of failure in professional exams for the medical students. Students from nursing, pharmacy, med lab, and the rest, as I've mentioned, they struggle to understand anatomy. They struggle to understand anatomy. But we are here to ensure that problem is solved. Now, the question is anatomy difficult? Why is students struggling to understand anatomy? That we require to pass anatomy. So passing anatomy with ease requires a combination of effective study strategies, management, and understanding the material deeply. Anatomy can be challenging because it involves memorization, applications of complex. So sometimes, as students, you want to memorize some of the structures, you are hearing names you've not heard before. So you approach anatomy with fear, but that is not supposed to be so. So first, what is the first thing we're supposed to do? We need to understand, don't just memorize. So focus on concept. We are reading anatomy, focus on concept. Instead of memorizing names and terms blindly, try as much as possible to understand concept, to relate structures with functions. So learn to look at the general function of the particular structure you are looking at. Let's say you're looking at maybe an organ, or you're looking at a particular muscle. So try to look at it from the function. So anatomy and physiology, they are together. So you need to understand the structure so that you can understand the function. Now, what is the next thing for you to do? You have to draw. Anatomy is structure. Anytime you are reading anatomy, as you are reading about a particular organ or structure in the body, try as much as possible to draw. Try as much as possible to draw. I do tell my students, you can't run away from drawing in anatomy. You can't run away from drawing. You must learn to draw. You must learn to draw. Anatomy is not about doing artistic things like those in fine arts, but learn to sketch. So if you are reading about the stomach, draw the stomach. That's why most time I do give assignment, draw. In the process of drawing, you are also trying to understand how it is. So time in exam hall, you just memorize, you just realize and just visualize the things you've drawn, and you can just move forward with that. So don't run away. Don't say, I can't draw, and you run away from anatomy. No, it helps in your memory. It helps in partial memory. So drawing is essential in the study of anatomy. Sharpen your pencil. Be ready to make mistakes, erase it, and correct that. Next one, create a study schedule. Anatomy is not a course that you just read at any time. It is something that you need to create a study schedule, break things down, break the material down. And if you want to read anatomy, break it down. Don't just take it from the holistic point of view, break it down. And when you break it down, it will help you to understand it as you are in the process of studying. Maybe, for example, take the skeletal system, look at the bones, study the bones. When you have studied the bones, before you can relate the bones to the muscles, don't just try to read the two together, it will confuse you. So don't read the musculoskeletal system together, study the skeletal system, and when you have studied a particular bone, before you can come back to begin to look at the muscles that can attach to the bones. Now, don't just read and say that you have read, you do not understand, or thereabout. Anatomy is something you need to be reading and be reviewing daily. So create a daily review of your study. Instead of cramming, don't cram. Try as much as possible to see how, even though you schedule just 60 minutes, 30 minutes of your time, 1 hour a day, to read your anatomy and study. Go to the museum, look at the bones, study them. It will help you. Relax while reading. Relax while you are reading. If you don't relax while you are reading, it will be difficult for you to understand anatomy. Create an enabling environment that will make you to relax. When you relax and you are okay, sometimes I do tell students, carry a bottle of water by your side and be drinking. Or you get your favorite drink and drink. Don't be in a tense situation. Read early. Start reading early. Start drawing early. Practice it. And you see that the anxiety will be reduced and you flow with the study of anatomy. The third point that is essential is use active recall. Test yourself. Actively ask yourself questions. Use flashcard. Like sometimes when I teach neuroanatomy, I do schedule some flashcard in my lecture schedule. So after maybe like 5-10 slides, I will just ask some questions with flashcard and then you answer. Ask yourself, constantly be asking yourself questions based on what you have read. It will make you to keep remembering that part of anatomy that you have read. This is very important. This is very important. Please, when you are reading anatomy, after you have read a particular topic, you have drawn that structure that you are asked to draw, create time to teach somebody else, teach someone else. Teaching or explaining the concept to someone else will reinforce your understanding. It helps in memory consolidation. When you want to teach somebody, you prepare adequately to teach. So make sure that you have a colleague, you have a friend that you can tell or call to say, okay, today I want to teach you the brachial plexus. You immediately say you want to teach the person, you see that your ability to read and understand will increase drastically. So try as much as possible to have a colleague or someone that you can be teaching. So it helps for you to understand. Don't just read alone. No, I like reading alone. While you're finished reading alone, maybe that is your style. You can look for someone to teach. If you are in a higher class, you can organize tutorials for those in the lower class and teach them. This is another very important point. You can use mnemonics to understand the basic concept in anatomy. It helps a lot. Like I normally, maybe in some of my classes, neuroscience, I give these mnemonics to touch and feel. Some version will say very green vegetables are, while some version will say to touch and feel virgin girl vagina. It will help you to remember the cranial nerves. So you don't need to cram the cranial nerves. You just wake up and you can just remember the cranial nerve with mnemonics. So you can create your own with any things you are reading, any topic you are reading in anatomy. You can create mnemonics and it will just help you. When you are in exam or when you just remember you can write and name all 12 cranial nerves. And there's also another mnemonic that will help you to know whether it's a motor neuron or a sensory neuron or it's a mix. So you must create mnemonics. It's very important for you to understand anatomy. There's another one there. I said Jacqueline's. If you want to remember joints, once you have read a particular joint, let's say you read about the maybe the hip joints or probably the knee joint or glenohumeral joints. Once you have read it, you can use these acronyms, Jacqueline's, to make you to remember the basic things that you need to know about that joint. For example, D is for the definition, articulation, capsule, ligament, movement, bursa, blood supply, as the case may be. It will help you to remember the joint. So once you just remember that claims, it will help you to organize your points and put it in order, and you are good to go. Now, use visual clues. Create mental images associated with the terms you are learning. For example, image a brain shape like a walnut. You can see the structures in the PowerPoint here. Once you just remember the way the shape of that structure is, it will create a mental picture in your head, and it will help you to remember that particular structure you are studying. So always create a visual clue. One of the things you can do as well in your room or wherever you stay, you can create some visual things around you. You can draw cardboard or stickers and put on your mirrors everywhere. When you wake up to look at your face, you are seeing the anatomical structures. Anywhere you are seeing these things. So it's helped to reinforce, to ensure that you remember. Please try as much as possible to go to the museum in your school to study the structures live. Don't just depend on what you see in textbook. If you want to understand anatomy, Go to the museum in your school to study the structure. You will see the way it is. You will see the way it is and study it. While you are reading, study it. Always study with a visual structure, what you can see. While you are looking at the diagrams in the textbook, also go to the museum to look at the structures by yourself so that you can see how the bones articulate. If you want to talk about joints, you can. So if you don't have some of these structures in your school, you can go to school where you can have access to some of these structures. It is very important. Okay, go to dissecting room. You see my back. You see a lot of anatomical structures. You see them. Go study them. Go to the museum and look at these structures and study them by yourself. Don't just copy notes in class. Go to museum, study them. Anatomy structure. You must go and study them. Look at the skeleton. Okay, look at it. By the time you look at the skeleton, you will begin to appreciate the cartilages. And for example, you are looking at the ribs, you appreciate the cartilages, you appreciate the bones itself. So it's very important that you go and study, go and carry the structures and study. We are talking about the brain. You take it, you look at the brain, you see the structures, you study them. Use your textbook, your atlas, and you look and compare to the physical structures in your museum. So anatomy is very interesting course, and it's something by which we shouldn't take it lightly. So please drop, if you have a question, you can drop the questions. I will attend to you. Joy, you are welcome. Pretty Joy, you are welcome. Praise, you are welcome. Purity, you are welcome. Elizabeth. Thank you for coming. I am waiting for your question. Please ask questions. It's an interactive session. Please ask questions. Just type the question in the chat box. I will respond to them. Anything you want to ask that will help you to study anatomy well, ask. I will attend to you. Type the question in the chat box. Favor Moses, you are welcome. Nobody's asking questions. You can form your own mnemonics. I talked about mnemonics. You can form the mnemonics. Then if somebody can just form one and drop in the chat box, let's see. Maybe you have read a particular topic. You can just form acronyms or mnemonics. Just do that. Oh, someone asked, sir, please, the course outline for an anatomy 210. Yeah, we are not in this lecture. We are not particular about we are not. I'm not talking about a particular course. I'm talking about anatomy in general. I'm talking about anatomy in general. Okay. So just ask for a specific topics, and I will explain. There are different courses in anatomy. We are just trying to, it's a tips on how to approach anatomy that will make it easier for you. Okay, so will they allow us into the dissecting room if it is not practical day? Yes, yes, you'll be allowed, depending on your department. If you are in anatomy, physiology, and medicine, you'll be allowed to dissect. But if you are in any other department, you'll be allowed into the dissecting room, but you will not dissect. You will be viewing the structures that have been dissected. So nursing students don't dissect here. I don't know for other schools. In Uniport, they don't dissect. Physiology, biomedical students don't dissect. No, pharmacy students don't dissect. It is only anatomy, physiology, and medicine students that can dissect. But you are allowed to enter into the museum. You can come to the museum. You can come to the dissecting room to look at the part that has been dissected. For those of you in Uniport, nursing, pharmacy, med lab, biomedical, that during the practical section, I will take you to the museum. I will take you to the dissecting room. So you will see the part that has been dissected. You will see it. You will see the cadavers. Okay, you see the cadavers. Please, more questions. Our section is 1 hour. After 1 hour, we'll be done. So now is interactive section. So ask questions as much as you can. So thank you, Goswi, for asking that question. The next question is, okay, Jack. Say, good evening, sir. My question is, how do I memorize the anatomical names and terminologies? Yes, if you are here for the beginning of the lecture, I will talk about understanding the concepts, understanding the rudiments. You don't just cram, don't cram in anatomy. Anatomy is simple. For example, okay, now look at these bones that I'm carrying. Okay, these are the bones of the forearm. Now this is the ulna and this is the humerus. This is the ulna, this is the radius, this is the humerus, this is the humerus, this is the ulna, this is the radius. Now between the ulna and the radius, there is a joint. Okay, there is a joint there called the radio-ulnar joint. You can see now, radio-ulnar joint. So it's very easy. If you understand that radio-ulnar joint is a joint between the radius and the ulnar, it becomes very easy than for you to cram. If you cram, you'll be thinking they're talking about something else. So anatomy is very simple. Just understand the concept. Why is it called that? Why is it called that? Okay, like for example, like the shoulder joint, which is called the glenohumeral joint. This is the glenoid cavity of the humerus. So the glenoid cavity of the humerus articulates with the head of inside the glen. This head of the humerus, sorry, this head of the humerus articulates with the glenoid cavity in the scapula. Let me see if I have a scapular bone here. Oh, I did not come with the scapular bone. I could have shown you that joint. Okay, look at it here. Look at it here. Look at it in the skeleton here. So the head of the humerus, okay, articulates with the glenoid cavity of the scapula. So that's why it's called glenohumeral joint. So you don't need to cram. Just understand the concept of those terminologies that you think is difficult. So anatomy is not that difficult as some people may think. Okay, let me see. There's another question. Esther George, thank you so much for this opportunity. Oh, you are welcome, Esther Joy. You are welcome. Please ask questions. If you have a question, ask it. Okay, sir, do we have museum in Uniport? Wow. As a matter of fact, I am in the museum giving this lecture. There is museum in Uniport where you have a lot of bones, a lot of models. So come and study. These things are for you. Unfortunately, students don't come to study with these structures. They are all available. I am in the museum. There are a lot of structures are here for you to view. All the bones are in the museum in Uniport. Uniport is a unique school. We have a lot of things that will help you in your study. But it is you to come to study in the museum. So thank you, God's will. We have 10 minutes to conclude this our lecture tonight. So ask your questions. It's an interactive session. How to write and pass anatomy with ease. Have you encountered any difficulty in trying to study anatomy? Share with us, and I will attend to you. Share with us. Please try and subscribe. Please subscribe to my channel, please, and share the link to others. You are welcome. God's will. Okay, purity. Sir, I find it difficult to understand anything about nerves and muscles in the body. Wow, that is an interesting question. That is interesting question. As I said, there are patterns of reading in anatomy. The way you read a joint is different from how you read about muscles. It's different from how you read about artery, vein, and nerves. When you are reading about joints, you can use the format that claims, as I've explained earlier. But when you are reading about nerves or blood supply, you are tracing it from is a structure that's coming from somewhere and go to somewhere. So you are tracing it from the origin. You are tracing the course of the artery or nerves, and then to what they supply or what they innervate. So that is the concept. From origin, where is it originating from? Very important. Now, what is the cause? What is the cause? Where is it passing through? Very important. And then what are the structures that they are innervating? Is key. So if you can understand these three parts of it, you can get a clearer view or clearer understanding of how nerve. Then for muscles has to do with origin. Oh, sorry, the light has gone off. I apologize for that, but just you are hearing me. You can start from the origin, insertion. When you have read about the origin, that's where it's originating from. Insertion, where it is terminating. The next one is innervation. That's what the name that is supplying that muscle. The next one is baby blood supply action. What is the action of that muscle? Or then you can now add the clinicals. The clinicals in case of injury or lesion, what happened? Then you've done justice to that muscle system. Okay, Gus will say cardiovascular system looks complex. Yes, it's a big topic. It's a big topic, but you have to break it down. Remember in our lecture, if you were there from the beginning, we say break it down. Break those complex subjects down. It will help you to understand it properly. Break it down. For example, cardiovascular, there's cardio and there's vascular. So the cardio has to do with the heart, the vascular has to do with the blood vessels. So take the cardio, read about the heart, and then when you have understood about the heart, you can now go to the vascular, which is the blood supply. Then when you are approaching the vascular, take the artery, take the vein, take the capillaries, you take the arterioles and the venous. So you see that it will be simple for you to understand them. It will be simple for you to understand them. Okay, Purity, thank you. You are welcome. You are welcome. Eukarya, you are welcome. You said you'll be the first person that you are just coming. You are welcome. Thank you for coming. Thank you for coming. Thank you for coming. Please type your questions. I'm here to attend to your questions. We have 5 more minutes to conclude. 5 more minutes. Sharon Allison say, good evening, sir. Please, can you explain the nervous system in man? Sorry. Just as I said from the onset, the essence of this lecture is not to take a particular topic and begin to teach on it. Okay, if you go to my YouTube, you will see I've dropped a lot of videos on the nervous system. I've dropped a lot of videos on the nervous system. Just check my YouTube, you'll see them. The essence of this topic is to help you, to guide you on how you can read on your own and understand, how you can write exams, anatomical exams, and understand. Okay, so it's not for me to now begin to take the nervous system. I have a video on the anatomy, the nervous introduction to the nervous system. So just go and read that. Just go and listen to that lecture notes, or to go and watch it, and you will get a better understanding on that. But make sure that when you are writing an anatomy exam, make sure that you try as much as possible to draw. I do emphasize on that. Draw. Don't run away from drawing. It is anatomy. Okay, Goswin said, I wanted to read blood first, before heart, then vessels. Well, when you talk about blood, that is physiology. If you want to read to understand function before structure, well, that is the way you want to approach it. But I think the better approach is to understand structure, to read structure, and then you can easily understand function. Okay. So I didn't talk about blood when I was answering that question on the cardiovascular system, because blood is is physiology, but anatomy and physiology are still together. So whichever approach that works best for you is okay. You can read blood and then come back to read about the heart and the blood vessels. Because that is good. If that works for you, it's fine. Then make sure you start reading now from the beginning of the semester, and don't wait till exam time and you want to read everything. It will be too much for you, and you won't get the best out of it. You won't get the best out of it. Okay. If you have more questions, you can ask. Please subscribe. Try and subscribe to this channel, because we'll be having more sections and more videos will be uploaded as well that will help you. Okay. So in summary of all we have done tonight is that anatomy, which is the study of the structure of the human body, which has both histology, gross anatomy, embryology, and the rest of them, is a subject that you must understand, you must know, in as much as you are in the medical school. You must know anatomy. You can't run away from anatomy. You can't dodge from anatomy, because even in your clinical practice, even in any whatever advanced professional groups, that you will still apply the knowledge of anatomy. So start reading anatomy, following the steps. I gave 9 steps in this video. Okay, it will help you to understand anatomy very well, and try as much as possible to draw. When you are asked questions like describe, draw. With the aid of a diagram, draw. Anatomy is structure. The anatomy lecturer that is marking your script want to see what you have been able to draw. So it's key to study anatomy and approach anatomy from that angle. Try as much as possible to go and study with the structures itself physically in your university. Go to the museum, go to the cadaver room to see or to dissect or to view the part that has been dissected. It will stick. What to see helps to consolidate your memory than just audio and reading. So try as much as possible. When you're reading about the humerus, keep the humerus like this. Look at it and you read, and you'll be looking at the parts as you are reading. It helps you to understand. In exam day, you will just see that you will just remember them. The memory will just come, and you write your exams and get your A's. Well, there's no further questions, and our lecture was for an hour. It's 8 o'clock already. I want to appreciate all of you for coming for today's lecture. I in fact, never take it for granted. I really, really appreciate your coming. Okay, thank you so much. Thank you. Thank you for coming. Thank you for giving me the opportunity to have this lecture, because without you, this wouldn't have happened. Please share the video to those that are not here, subscribe, and get ready for further videos that will come on this channel. Thank you, and bye-bye.